As a speech-language pathologist, treating a child for misarticulation, a person who stutters, a patient who had stroke and can no longer use language, or someone who has impaired hearing, the essence of treatment and all clinical improvement is always about changing some aspects of the patient's behavior, perception, or cognitive state. These mean changes to the structure and operation of the nervous system. Everything we do as clinical speech-language pathologists will be based and have a direct impact on the structures and function of the client's nervous system. Neuroanatomy and physiology encompasses all SLP areas such as phonology, voice, stuttering, language, swallowing, cognitive rehabilitation, motor speech disorders, auditory rehabilitation, hearing aid use, and so on. We are always looking into the behavioral, perceptual, and/or cognitive adaptations in treatment practice and its impact on the client's performance and outcomes. We then understand why or how treatments do or do not work. This includes understanding scientific principles on the functioning of the brain during normal and disordered speech, language, and hearing behaviors, better understanding cognitive behavioral relationships in order to make appropriate clinical assessments and treatment decisions. Neurosciences are areas that contribute to the SLP practice. Clinical interventions function to organize the sensory and motor experiences of the patient by controlling the complexity, frequency, and form of various therapeutic tasks. Speech pathology needs to continue making up ground to more deeply understand, embrace, and incorporate neuroscience principles. All available evidence points to the conclusion that treatments provided by a therapist directly impact the individual's nervous system. Principles of neuroscience and neuroplasticity form the means through which therapists' impact on a client's nervous system will be realized.